necessary for us to look back and talk about specifically what it means to not have a CLABSI for 3 years at SLU Hospital in the highest acuity unit that we have. You know, what it means to expand your bed size by 9 rooms, moving from Legacy to the new hospital, and not have your line dates change. And you know, when we pulled the data going back to May of 2018, there were, and I want to make sure I have it correct, 3,950 line days, over 12,400 patient days. And our predicted line days was nearly 7,000. Now the SLU Hospital is budgeted at a CMI of 2.4, which is high. And in 3 ICU, it's about 7. There are months that we are over 7 in that space. So across all academic medical centers, the AAMC database, SLU Hospital runs at 95% above CMI, so the highest acuity across the country. And yet we only utilize 60% of our predicted line days, and during that same period of time, take no mention of the fact that we moved hospitals on a lazy Sunday afternoon. We made it through the pandemic of 2020. There was no change to the infection prevention and patient safety that was ongoing, which is a real reflection, certainly of Lisa, which is a reflection of Chris, this is a reflection of Nicole and the entire team here, Carl Freeman, Gassan, really anyone who's involved in those spaces as far as where we're at. Just so much going on for it. So really a kudos recognition and thanks for Dr. Garza and our IT team from the system and region being here today, but it's really important, and I'm gonna see the rest of my time. I know Rita wants to have a couple of comments, but just looking at these numbers outright, 60% of our predicted days, over 12,000 days, and not a single CLABSI, and just, you know, the only adult level 1 trauma center in our health system, particularly impressive. So big kudos and thank you.
Super. Thanks, Dr. Bird. So I just really want to extend my deepest appreciation to Lisa for the great work that she has done on 3 South ICU. You know, I know that 3 South functions as a team with Dr. Freeman, Dr. Kamal, and the other intensivists who work down there. But Lisa is in there, in the patient's room, every single day, really probably dogging this, right? She is, so she is in there looking at practices. She's looking at sites, she's looking at dressings, she's looking at IV tubes, she's looking at IV bags, she's looking at why don't we have another alternative because this patient isn't on a pressor and hasn't been for 8 hours or whatever. So she's really going in to evaluate the components of the bundle. She's watching her nurses practice. Are they scrubbing the hub? You know, how are they doing? Are they we call it clean the cabin, where they disinfect their work area. Lisa is in there really ensuring that the practice is pristine. And as a result, 3 South has been without a CLABSI since May of 2018, is that correct? That's amazing for a level 1 trauma center with the CMI that we've seen here and in the number of lines we have, although as Dr. Bruno alluded, you guys do a phenomenal job at looking at other alternatives. So clearly it's a team sport, right? We appreciate the great work from our intensivists in getting those lines out. But Lisa, we really appreciate your diligence, your persistence, your perseverance, your commitment to excellence and safety of our patients. So thank you. And I'd like to introduce Dr. Garza. If you're not familiar with Dr. Garza, gosh, in 2020 and early 2021, this is how I learned who he is. I saw him on TV, right? And so he has been very instrumental with the pandemic task force here in St. Louis. So, Dr. Garza.
Well, thank you. So I don't know if I have too much more to add to what everybody else has said. So I will just say before I took on the pandemic world, of course I was the chief medical officer, and so worked a lot with infection prevention, a lot of hours spent with infection prevention, looking at data and understanding what the challenges were. And so when Chris Ergus told me about this award, I was like, that is amazing. It's phenomenal that you would be able to accomplish this, and especially given all the challenges that we've had, not just the regular challenges that we have with the patient population and how sick these people are, but going through an entire pandemic and being able to do that as well. And you guys were a COVID unit also. Yeah. I mean that's just amazing. So a couple things I just wanted to leave with you all, and that is, when you're thinking about how do high functioning teams accomplish stuff like this, it's a commitment from top to bottom. It really is. And so you have to have people providing strategy and vision, but you also have to have sort of that middle tier that then implements the strategy and vision, but you have to have buy-in from everybody and the integrity. And that's how you accomplish great things. Now, during the course of the pandemic, we've had a lot of challenges here in St. Louis, across the country. But it really showed me what we can do when we all are focused on the problem. We're all trying to find a solution to something. We can do incredible things. And so this is really, in some ways, it's a microcosm of what we can do with bigger things that we have to address. So anyway, my heartfelt thanks for inviting me, first off, but thank you for all the great work that you've done these past 18 months and for accomplishing this just phenomenal thing. Now, if you can take that, replicate it for the rest of the system, that would be awesome. Okay. And I think I'm turning this over to Lori. Is that right? Okay. Thank you.
My name is Lori. I'm one of the infection preventionists here. And I'm just going to start by giving a little bit of background about who Janet Mueller was. So Janet Mueller was a respected infection prevention nurse here at SLU Hospital from 2006 to 2013. She was dedicated to keeping our patients safe and infection-free. Many remember Janet wheeling down the halls of the Legacy building on her scooter, greeting everyone she passed with a smile. Those who had the privilege to know her know what an honor it was to work with her and receive this award. The nurses in this room all know the famous authors of Potter and Perry Fundamentals of Nursing textbooks. Janet was good friends with Pat Potter. Pat Potter dedicated this award to SLU Hospital on Janet's behalf. It is now called the Janet Mueller Infection Prevention Patient Safety Award. This award is to acknowledge healthcare providers who strive to promote patient safety by helping prevent infections. 3 South is a unit that knows no boundaries. They are not afraid to tell you what they think. They always put their patients first, and approximately 3 years ago, we implement what is known as the bundles. These bundles were created to prevent both CAUTIs and CLABSIs. Prior to implementation of these bundles, the nurses felt that lines and Foleys were truly needed to care for their patients. This was even true on 3 South, but Lisa and her team faced the challenge head on of changing their culture, and changing their culture is exactly what they did. Lisa learned the why behind each bundle element and in turn taught her staff the same. The staff on 3 South has been supported by all the physicians on the unit. The physicians primarily on this unit are our trauma physicians and our MICU teams. They all work collaboratively with nursing to provide exceptional patient care and promote their safety. Together, these teams have reduced their infection rates and device utilization. Between 2018 and 2020, they decreased their CAUTI rates by 80%. They have been CLABSI-free for 3 years. Not only do they ensure bundle elements are performed, but they are also have a heightened awareness of hand hygiene and PPE compliance. I would not get caught walking into a room up there without washing your hands or wearing your PPE, because they will counsel you on that. During 2020, this unit was a primary COVID unit caring for some of the sickest patients in St. Louis. Throughout this trying time, the staff did not lose sight of their role and continued providing exceptional patient care. During this difficult and emotional time, patient safety was still the utmost priority and no infections were identified. As an IP, when I visit the unit, staff are always ready to discuss all of their lines, why are they in, and which ones are already out. Even when I'm not there for device rounds, they still tell me every time I go. I am overwhelmed by the teamwork displayed by the physicians and nurses to keep all of our patients safe. We want to thank all the staff members of 3 South ICU, the MICU team, and the trauma team for all their hard work. On behalf of Infection Prevention and our patient safety team, we would like to award the 2021 Janet Mueller Infection Prevention Patient Safety Award to the team on 3 South. Lisa Hesse and her team, Dr. Carl Freeman from Trauma, Dr. Ghassan Kamal from MICU. Without all of you and everything that you all do, this would not have been possible. So we ask you all to come up to receive your award.
Thank you.
She's my cheat sheet. I call her for everything.
I will say if you've ever covered Lisa's unit while she's out of town, which is hardly ever, and you walk on her unit, her nurses tell you immediately, we have 4 Foleys and 2 lines that are coming out. I'm like,
Yeah.
I gotta say one thing, really, this goes to Lisa and the nurses on that service, on that floor. It's really her and her team of nurses that's done this. It really is. And the other thing is, she's made it where she's approachable and comes to us and discusses stuff with us proactively. And so it's her team. So
Oh, thank you.
this is really good.
It's a trust. I know if I say I'm gonna go tell them, like,
Oh, yeah.
I like to tell the resident, this is not a good idea, I know I have their support, and it really is about building that trust that we're on the same page, and then everyone else better be on that page too.
But if you-
I completely agree. I'm not gonna, everybody said it's great, phenomenal work, Lisa and Chris, that's great leadership, and the fact that they were able to move from a trauma surgical unit in the middle of pandemic to take care of just pure MICU patients with ARDS, chronics. They had a great way to adapt to a different patient population, so that's awesome. Congratulations, and just congratulations to Carl as well for this. And I want to thank everyone involved, including nursing staff, trauma residents, trauma attendings, and our MICU team as well, and the fellows. So it's been great. This is a great
And the
achievement.
MICU team coming in and working with our ICU on 6th during the COVID pandemic, and then taking that over. They did an excellent job with this too, the whole team. So.
And just, the staff from the get-go, I have to say, they wanted to learn. The second we get on midline trained, or that someone's like, do you want to do a study? We're like, yes. Pretty much if anyone wants to do a study, we're like, yeah, we'd like to have buy-in, we'd like to have input and give feedback. So I think that their willingness to jump in always, no matter what it is, they're like, yeah, we want to have a say, so let's try it, let's do this. And I know, for many of you may know, I was out this summer unexpectedly for a time, and I know they were still doing everything the right way because it's the way they should do it. They didn't, even though I micromanaged, they didn't need me there to do it because they knew the right thing, and they went ahead and they're like, we're not gonna let you down. And I thought that commitment to each other was amazing, so thank you guys.
Thanks, Chris, for